In the headlines, port surveillance stepped up as health authorities focus on keeping the country safe from the coronavirus. A state college student wants men involved in the discussion on women's rights. And organizers say stardom-turned crowds this time around are not meeting the expectations. I'm Andrea Louis with the Channel 5 News. Back with the details after this.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better. A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited Flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD. All for $160 a month with the new all-in bundle. With Flow, it only gets better.
Thank you for staying with us. First up, health officials have reassured the Dominican public that the country's ports of entry are sufficiently manned and monitored to keep the coronavirus out. With reports of St. Lucian health officials placing a foreign national in quarantine, locals have been concerned about the potential dangers of traveling into Dominica for Carnival from neighboring islands. But Senior Environmental Health Officer Clara Charles, who has responsibility for port health, says all ports are covered.
Based on currently available information on the coronavirus, World Health Organization advises that measures to limit the risk of exportation and importation of the disease should be implemented without unnecessary restrictions of international traffic. Currently, the Environmental Health Department have implemented the following measures. We have developed our standard operating procedures for ports of entry. With respect to ill persons, we have identified isolation areas at our 3 main ports of entry, namely Douglas Charles Airport, the Cabritz Cruise Ship Berth, and the Rosa Ferry Terminal. We are currently doing routine screening of passengers with a travel history within the past 14 days from China at the 3 main ports of entry as mentioned prior. And the port health officers are monitoring passengers with support from the immigration and customs officers. We also complete interviews with the passengers using our COVID-19 case-based form and also performing temperature screening. We are also disseminating alert cards to the passengers, and those alert cards have been developed by the Health Promotion Unit, giving information on the signs and symptoms of the disease, how they protect themselves, and what to do if a passenger is experiencing any symptoms.
Port officers have also been trained in standard operating procedures. She explains what would happen if a passenger were to arrive here with a travel history from China.
So even that a passenger is entering Dominica, they have a travel history from China, but is showing no signs and symptoms of the disease, that is, they are an asymptomatic passenger, we would follow clearance with immigration. The passenger will be interviewed by the port health officer using the case-based form that we have developed and our temperature screening. If the passenger shows no signs of infection, the person will be requested to isolate at home and restrict movement for 14 days. An alert card is provided to the passenger on what to do. The information is communicated to other officials within the Ministry of Health, and the passenger will be monitored through household or virtual surveillance by telephone or a public health nurse to check for their symptoms. Now, in the event we do have a suspected case, then the pilot will contact air traffic control, who will in turn contact the aircraft company's agents and the port health officer. And at that time, the standard operating procedures for medical or emergencies relating to communicable diseases or medical emergencies will be implemented. And of course, isolation will be at the Princess Margaret Hospital.
There is also a protocol for dealing with cruise ships with suspected cases.
Guidance for vessels, cruise ship vessels, ferry, cargo vessels. Usually, for our cruise ships, there are no cruise ships that directly come from the Asian countries which come to the Caribbean. All right? So most passengers would arrive to the Caribbean cruise ships via commercial airlines, either through Florida, Barbados, and they would embark onto these cruise ships within the ports of entry. However, before arrival through any ports of call, the captain of the vessel is required by the international health regulations to submit a copy of the maritime declaration declaring the status of health on the vessel. Therefore, in the event that a passenger or crew is ill with a communicable disease on board any of the vessels, the port health officer will be alerted within 12 to 24 hours prior to entry into the next port of call. In the event there are any cases of illness, the captain of the vessel is also requested to update within 4 hours prior to entry to the port of call also. And as a precaution, there is a 2% threshold for respiratory infections and gastroenteritis. That is a requirement also. So therefore, in the event that the vessel has a less than 2% threshold of crew and passengers that are ill with respiratory infections and gastroenteritis, then the free practice is granted, or either the permission is granted to the vessel to come into the port of call, and only the healthy passengers will disembark. That is also after the port health officers has assessed the medical logs, looked at the outbreak prevention plans, looked at disinfection methods. All of those will be decided on board the vessel. Now, in the event that the 2% threshold has increased to 3% and more, then no free practice is granted. The vessel will not be allowed to come into port, and it will go on to most likely the next port of call or back to its original port.
In related news, training of medical staff, including doctors and nurses, has formed a key component of the Ministry of Health response to the coronavirus.
Dr. Ruby Blanc, Medical Director at the Dominica China Friendship Hospital, was part of a panel of health officials who provided an update on the coronavirus during a discussion on Thursday. Dr. Blanc says training is being provided for hospital staff across the board.
These training sessions, those specifically held for the doctors and nurses, concentrated on the clinical aspect of the disease, what signs and symptoms we were to look out for, how we would diagnose or identify somebody with the condition, and what type of clinical care and management we would start once the diagnosis was suspected for a patient. We also have been concentrating very, very much on our infection prevention and control practices. It is a disease that can be passed on from one person to another, and of course, infection control and prevention then becomes even more critical. So we've been focusing on things like the use of the PPEs, the personal protection equipment, hand washing techniques, among others. And we've ensured that all categories of staff, not just the doctors and nurses, have been exposed to those educational sessions.
Dr. Blanc says they are in the process of organizing simulation exercises for the clinical staff. A hospital response plan has also been developed.
And that plan essentially says what to do, when to do it, who should do it, where it should be done. And we've created what we've called clinical flowcharts or pathways, and that will guide us as to if a patient comes in, and based on what point of the hospital that patient comes in, what we as staff are supposed to do to diagnose and respond to ensure that the patient is properly taken care of, but also to ensure that the patients and staff are not put at any unnecessary risk.
Isolation sites have also been identified.
And those would be sites within the Accident and Emergency Department, in ICU in the event that we were to get some very seriously ill patients from the virus. And we've also identified an area where we can have inpatient admission for patients who will not necessarily meet the criteria for ICU, but obviously need inpatient care. And we are continuing to familiarize our staff with all aspects of the plan and the clinical pathways, so again, that persons will know what to do if a case were to show up.
Blanc says they are in contact with the central medical stores to ensure that supplies they need are in adequate quantities.
Specifically in the form of the PPEs, masks and gowns and gloves, we ensure that we have adequate supplies that are available, and it's something obviously that has to be monitored as time passes to ensure that those supplies remain adequate.
In other news, Stardom Tent is reporting a lower crowd turnout than in previous years. Julian Morris has that story.
The first scheduled staging of the tent was postponed due to inclement weather on that day. The tent is being held on alternating Wednesdays and Saturdays during the carnival season, and coordinator of the Stardom Tent, Emmanuel Hixie Salamat, says so far crowd attendance has not lived up to the organizers' expectations.
The tent hasn't been going good as far as patrons coming in is concerned. But honestly, I must tell you, the show itself has been superb. The artists have put on great show, and swinging stars are playing out of their skins. So we know when you come to Stardom Tent, you're coming to a great show. But participation, I don't know what is wrong, and it doesn't only mean Stardom Tent. We see the same thing in the other popular tent, and we also see it in DCA Calypso competition.
The Stardom Tent will be moving to Portsmouth on Friday to be staged at the Cabritz Resort and Spa Kempinski. Some of the proceeds from this tent will be used to assist an elderly Calypsonian.
And it's a 5-star Stardom experience, and it's done with some of the proceeds going to one of our great Calypsonians, that is Miko. You may have heard of Miko. He's one of our elders in Calypso, and Miko is going to get some of the contribution from that show, and he'll also be making an appearance, and all the top Calypsonians of Stardom Tent will be there.
There'll also be a tent on Saturday night in Lale Coco, and this tent, though, will feature artists from Grenada.
We come back to Roseau on Saturday, and we'll be at the Strip, and we're having a massive show. It's very, very cheap. We're not raising the price, we're just leaving it at $20, but we're expecting a lot of people. We are naming it Grenada Invasion. Besides our Stardom people, we have 3 soca Calypso artists from Grenada. That guys bordering on the Trinidad, or on the Trinidad thing. They go to Trinidad now and then to perform it, etc. So we have that.
The Stardom Tent will host its Monarch of the Tent competition next Wednesday.
You are watching the Channel 5 News. Stay tuned for more after the break.
Here are some tips to reduce mosquito presence in and around your home. Keep water storage containers properly covered. Remove containers that can collect water from your surroundings. Keep garbage bins tightly covered. Pick up your litter and remove all tires from your yard. Keep gutters free of leaves and twigs to prevent stagnant water. Prevent Zika, dengue, and chikungunya. Fight the bite. This is a public service announcement from the Dominica Red Cross.
This message is supported by Flow.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts, with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better. A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD, all for $160 a month with the new all-in bundle. With Flow, it only gets better.
Welcome back. An 18-year-old Dominica State College student is hoping to bring greater awareness to women's rights. Kaja Charles, an information technology and economics major at the DSC, says the role of women has changed over the years, but there is still more which can be done to improve women's rights.
I mean, in modern society, you see all the hardships, especially black women, go through. And I wanted to take a stance on that, me being a woman as myself, and I wanted to have the power to change that in at least Dominica, if that's as far as I can go. But I believe that small things can get bigger with time. So I wanted to be an advocate for women everywhere and tell them, you know, you can speak out even if people don't listen to you, they will hear you. You can see that there has been a change in the way women are in society. You see a lot more women coming out in things. I mean, especially black women, they're stepping up, we're in everything now. There's not a lot that women can't do. And I feel like that's a good start. We're starting to move up from somewhere, and for me, that's a big thing.
In a lead-up to the Miss DSC Mass Jamboree show, Kaja plans to bring greater awareness to women's rights among her peers at the State College. She also believes men need to be included in the conversation.
For myself, I'm an information technology major, as I mentioned before, and you hear a lot of people saying, you know, women shouldn't be in this workforce or that workforce. So I think that's a big thing for me, that I can fix a computer just as good as any man can. You know, you have something to fix in your house, then I can do it too. I do think because men have the bigger voice, unfortunately, it would be good to get them on board with us, because they can also advocate for us in places that we cannot or places that we might not be heard in.
Kaja Charles is sponsored by Big Edge Financial Express. A 14-year-old third form student is calling for more emphasis on skills training in schools around Dominica. Sahara Bowers, who is representing the Dominica Grammar School in the Miss Teen Dominica pageant, will be turning 15 on the day before the competition. For her platform and even after the show, Sahara plans to advocate for all schools to have their students participate in a wider range of skills training programs.
Well, my platform for the show and also for my school, I would say some of my school, I would like for my school that we would develop more curricular activities after school to help the students develop in skills development in areas, because their future job may not just be only what we learn in school, but they may also want to take part in maybe sewing or, you know, maybe acting or singing like me, or, you know, building different things. So I would like my school to have, or actually all schools to have, different maybe after classes where children could come and learn different things to develop their talents more and make them more able to do different things that they're not right now. I would go to my school and maybe I would like to speak to the students and also the teachers about the idea of having after school activities where we can all find out our abilities and our talents, and other schools also as well, to have extra things where we can learn about ourselves and more about what we are capable to do.
Ms. Bowers, who wants to be a motivational speaker and singer when she grows up, says she chose to vie for the title of Miss Teen Dominica in order to inspire others to go after their dreams.
I decided to go up because I wanted to be an example, especially to people, to young people as well, but also older people, because you're not too young or old to inspire anybody in life. I wanted to go up because in my future, my goal is to become a singer and also an inspirational speaker. So I think it would give me exposure and also build my confidence and help me to be more responsible.
Sahara Bowers is sponsored by Do It Center. And debate on the supplementary estimates in the House this week was not without conflict. The Honorable Parliamentary Representative for Roseau North, Daniel Lugay, was admonished by Speaker Joseph Isaac when he suggested that local doctors were being persecuted.
I'm also concerned, Mr. Speaker, about the persecution of our indigenous doctors.
But again, the representative for Roseau North, Honorable Lugay, you can't say that there is persecution of Carinago people.
Mr. Speaker, and I
you can't. You
targeting.
Yes, but
targeting of our local doctors.
Remember, I'm on the floor. You cannot have your seat. You cannot do that. Because you see, and this morning I cautioned, because we have a responsibility, not only as Dominicans, we are in the highest lawmaking institution of this country, the Parliament. And if we are making statements such as these, we are putting even Dominica in disrepute. So remember again, you can come back on your feet, but again, I'm asking you to really be restrained and remember the standing order in regards to imputing improper motive.
Mr. Speaker, I'm talking about the sidelining of indigenous doctors of the Commonwealth of Dominica. I'm referring to doctors like Dr. Irvin Pascal, Dr. Sam Christian, Dr. Pharaoh Coffey, who are like persona non grata in the Commonwealth of Dominica.
Remember, please have your seat. Please have your seat. And if you are not prepared to understand what imputing improper motive is, then you are not prepared to deliver.
To end the news, the headlines again. Port surveillance stepped up as health authorities focused on keeping the country safe from the coronavirus. A state college student wants men involved in a national conversation on women's rights. And organizers say Stardom tent crowds this time around are not meeting their expectations. Feel free to access our past newscasts on our YouTube channel. On behalf of the entire production team, I am Andrea Louis, and to all of our viewers around the world, thank you so much for watching. Join us next time.